Hi everyone, I'm Joey Remenyi from seekingbalance.com.au. I'm a vestibular audiologist and I take the whole person integrative medicine approach. This is a philosophical approach which really looks at you and how you're relating to your inner world and your outer world. When people are diagnosed with vestibular audiology conditions, sometimes the diagnosis doesn't quite feel right, or you see 5 different doctors and get 5 different diagnoses. It can be very confusing. And the reality is that a label doesn't define you and it doesn't describe why you feel what you feel. Part of conventional medicine or Western medicine is a reductionist and linear paradigm. And there's a lot of great, useful information and data that we collect through conventional, traditional Western medicine. I myself will go to the doctor and talk about things whenever I feel I want to have that conversation and be in collaboration. Integrative medicine looks at the physical, mental, emotional, spiritual, the overall social well-being of a whole person, alongside what might be identified through Western medicine labels and diagnoses. So essentially, you may be told you have triple PD and vestibular migraine, but at the end of the day, you're you. More than anything, you're a whole person with relationships to your family members, with a place in your social and wider community, in the global context of the political and environmental place where you are relating. There's the nutrition and the food. There's thinking about the microbes of your gut and how you're able to take nourishment from the world and excrete what isn't serving you. There are so many layers to you. There's your joys, your pleasures, your hobbies, things that fire oxytocin, dopamine, serotonin, endorphins, all these feel good neurochemicals, which are directly related to how you choose to walk through your day. So when we look at integrative medicine and when I meet my clients, I don't just see vertigo and tinnitus, I see an entire story of interconnected choices, behaviors, habits, patterns. There's an entire history of a person that is mapped within their physical body. So when you are looking for support for your symptoms, your sensations, your condition, I recommend that you get to know who your providers are. And in essence, you're looking to build a little village for yourself. I think personally, and I think this has been actually evidence based researched, the most important piece in searching for a doctor or a health professional, any kind of provider, is trust. It's so deeply important that your nervous system feels at ease, comfortable, and a level of authentic connection with your providers. So I want to invite you to do some research in who you're talking to and who you're working with. I think it's useful to have people from different backgrounds, um, but ask them what's their training, get to know what their standpoint is and what they're willing to offer you. Sometimes you'll find there's a culture clash between you and certain providers, and all of that's really healthy and normal because different humans have a different lens on life and a different perspective. So when you're working with integrative medicine doctors, you want to see that they're talking about the full big picture, might be collecting information from all sorts of different parts of your physical body and your social connections and your emotional health. And they're helping you navigate ways that you can feel more safety and more belonging more often. You might be wondering why I bring that in, but essentially it's beyond genetics and lifestyle and diet. When we think about the way our brain works and our nervous system and our body is communicating through our nerve cells, the body is essentially always looking for safety, belonging, and loving. These qualities help us to completely relax and fall into optimal firing patterns. When our nervous system is in that socially connected safety and belonging zone, our immune system improves. We have less incidence of autoimmune conditions. So we have this psychoneuroimmunology that's going on. When we're unsure, when we're experiencing self-doubt, when we're overwhelmed, overloaded, when we don't trust our providers, when we're skeptical about tests and diagnoses and investigations, we're actually neurologically in our body feeling these chronic stress symptoms and cycles flowing onwards. So coming back to get to know your village, maybe even slowly take your time to build your village. Try and find providers who you feel you can trust, collaborate with. So integrative medicine providers are your equal. They don't come at you from a hierarchical place. They're not the expert in you. Your integrative medicine providers are expert in what they're trained in. So for me, vestibular audiology, I understand that. I'm trained in that. I've seen thousands of people, but I'm not the expert in you. So we come together as collaborators and we use our joint expertise to look at ways to co-explore how you can be supported to gently move forward and experiment with how you relate to yourself and how you might be able to support your body and brain to function at its best. I want to just speak to functional medicine. It's functional medicine providers may or may not have medical degrees, and they will tend to take lots of metabolic tests to look at how they can have a very individualized, patient-centered approach to whatever's going on for you in your physical body. So integrative medicine and functional medicine, while there can be some overlap, they are actually different ways of moving forwards. And again, there's no right or wrong way to be curious about your body and to gather information about your body. I would always invite you to check that you trust whoever you're working with and that you listen to your nervous system and make sure you feel safety and belonging as you're going through this investigative process. Sometimes I think we can get lost in the detail rather than sitting back and looking at the bigger picture of who we are as a whole person in community. So I was thinking, if we look at somebody with a vestibular condition and they go see a Western modern day medical provider through the reductionist or linear model, they may get diagnosed just based on their symptoms. They may get medicated with antidepressants or anti-anxieties or migraine medications. They may get prescribed some generic bedside exercises, and then the doctor sort of reaches their limit of what they can do and they refer on, because they're not looking at you as a whole person. They're looking at the very specific part of you that you're bringing to their office. Whereas if you were to potentially go to an integrative medicine provider, they may be looking at your entire sensory relationship to the world. And part of that can take us down a conversation of neurodivergence. Maybe your specific and unique brain and body are very, very, very acutely sensitive to all of the felt sense, smell, touch, visual busyness. And so the vertigo and dizziness may be like a little default part of what the underlying story is that your body may need more rest, more quietness. You may need earplugs when you're out and about in crowds, not because you're sick, not because you're crazy, not because there's anything wrong with you, but because your body is so finely tuned to the outer world that when you go into a crowd, you have so much neural firing. It's like a disco in your brain and body. It's overwhelming. The sensory landscape of our nervous system becomes before our emotional, behavioral, cognitive layers of self. So you can do as much cognitive behavioral therapy as you like, or as much emotional acceptance as you like. None of that will budge the sensory reality. If you need to understand your sensory system and how to moderate sensory input, everything else is kind of a waste of time. So it's like we want to go down to the most primal root cause, the most primal place where we can have impact. And again, this is the safety and belonging. If I know how to navigate the world with my sensitivities, with my unique brain and body neurology, if I feel empowered to know I've got my earplugs in my bag and if I need them, I'll use them, I can actually remain safe, a sense of belonging, a sense of empowerment, and I can navigate my day with confidence. If I don't have that information and I never went to see an integrative medicine doctor who may have brought that to the table, I can just go through life feeling dizzy, feeling lost, feeling overwhelmed. I have no skill set. I have no tools. I don't understand my brain and body. I don't know how to create a sense of sensory comfort. That entire conversation is just never had. So this is where having this whole person approach can really just open us up to understand our authentic self, our authentic needs. The integrative medicine model is looking at the whole person. It's honoring the complexity of every single choice, behavior, relationship, the interconnectedness of all that impacts the way we digest food, the way our moods fluctuate. It impacts how clearly we think or don't think. So there's this huge interconnectedness between all of our physiological systems. Sometimes we say we're looking for root cause, but really it's not linear. So it's not like you have a splinter in your toe, let's get the tweezers and pull it out. There's not necessarily one root cause. So as I explained earlier, it could be a neurodivergence and a deep dive exploration into sensory comfort, sensory safety, which will give somebody their life back and they take full control and off they go. But on top of that, it may also be some relationship conflict and an ability to speak up, advocate for one's needs, to honor the reality of discomfort and vulnerability, and to be able to communicate that in relationship with others, whether that's at home or at work. So that's another layer of the learning and of the brain and body finding safety and belonging. So I think looking at root cause is a little too simplistic because we're really talking about complex systems that are overlapping with other complex systems in our body and also in the outer world. So we have a lot going on, which is why, again, it's really beautiful to have a village, to have a community to hold you and support you through this co-exploration. So, from the World Health Organization, integrative medicine is defined as a state of complete physical, mental, and social well-being, and it is not merely the absence of disease or infirmity. So, this does not mean it's in your head, it's not psychosomatic, it's not imagination. The fact that you may have a clear MRI and clear blood scan results and everything's coming up, no abnormality detected, none of that means anything from a whole person approach. Really, it means that you don't have any immediate medical treatment needed and there's no imminent danger to your physiological health, which is great. And I encourage all of my clients to get their MRIs, their blood scans, and have that peace of mind. But you are still feeling something that doesn't make sense to you. So the question is not what's wrong with me. How do I make sense of this? How do I support this? And who are my people? These conditions are not for life. They are reversible. You can change your sensory landscape based on your relationship to your body. You do not need to look outside of yourself for endless treatments, devices, or fixes. You can incorporate a blend of devices, medicines, and fixes on top of exploring neuroplasticity and understanding your sensory landscape. But I just feel like it's very unhelpful to think that there's no cure, that you're stuck, that it's static. Your body will change. That's the one scientific certainty we have. Your body will change. Your sensations will change, and they actually may get louder or they may get softer. They may get stronger. They may dissolve into nothing. We help adjust the volume and we help to gauge whether sensations grow in their neural mapping or whether they shrink and disappear. This is the art of both neuroplasticity, neuroscience, and also presence, kindness, loving awareness. And this is where the integrative medicine helps us to bring in some of those very ancient practices from the East and combine them with the reductionist, incredible knowledge we have from modern day science. And where they meet, we get the power of both. So I really want to encourage you to be open minded. Yes, be skeptical, but a healthy amount of skepticism that allows you to stay curious and trial new things, learn about your body, learn how things can and do change. I no longer have any tinnitus, vertigo, or dizziness, and many of my community members have regained their sense of center, groundedness, and clarity. So I've seen this again and again, and I really feel like as a community and within Veda, we need to dispel some of those myths. Integrative medicine is not a them versus us world. When you step into the concept of integrative medicine, you're still going to go see your local doctor, talk to your neurologist, visit your ENT surgeon, visit your audiologist, speech therapist, and so on and so forth. We're creating a village where each expert has that little package of data that they're giving you. And it could be that you then go and find somebody with a specific interest in integrative medicine who helps you tie all of that information together and make sense of it for you and your body. So, for those of you who are feeling interested and resonant with this idea of the whole person and the co-exploration space, I am really passionate about providing safe spaces and what I call sacred spaces online for people to experiment. I want you to feel that you can be vulnerable, authentic, to grieve, to be real about what it's like to be you. And my Rocksteady community really is a space for you to explore how you do you, how you be you. And most importantly, I would love to invite you to get to know what kind of brain and body do you have. Like, there is really no such thing as normal. We are all so different. I want you to understand your sensory landscape. I want you to understand your emotional world, how you self-soothe, how you befriend yourself. And I would love to see you be able to have a really deeply difficult day and to feel a genuine sense of, I've got this. I actually know what to do. I know how to handle this. I know this will pass, and I'm ready. That's my wish for you, and this is what the Rocksteady community provides.